go grab that plug. Oh, it's under there. Good. And I need the other, the ring light. not counting. Okay, welcome everybody. I put on my little microphones here. Sorry, my little counter didn't count down the right speed, but we're here. Okay, hopefully you can all hear me well. So today we're going to be talking about neuropathy. Peripheral neuropathy specifically, that's that nerve damage that happens in your feet. So I want to give you, it's about relief, right? So those of you who have it, you're suffering. So there's another way. I want to give you a new perspective, some things you have never heard before, almost certainly, some causes, and most importantly, solutions. So you're investing your time coming here, and so I appreciate that, and I want to give you some valuable information that will be worth your while. Let's make sure we get all of our technology working here. All right, so I'm going to start out with telling you my story. So each of you have your story about why you're here tonight, why you're listening to this, the suffering you probably have been dealing with for a long time. So this is my grandfather, called him Granddad, and my grandmother, called her Granny, and they were both really special to me. So my grandfather, he had something called neurodegeneration. I discovered this when I was 9 years old. So I was living out of state, and every summer, and more often, I would come visit my granddad, and spend the summer with him, and it was great. So one time I came back, and he was in a nursing home, and it was all sterile linoleum floors, or, and he had his room in this hospital bed type thing. And so I come in there, and he looks just like this, except happier. So happy to see me. It was great. But he didn't know who I was. This is my granddad. He didn't recognize me. He had Alzheimer's disease. And I left the room crying, and I never saw him again until I saw him in his casket when he died not long after that. So this is important to me. Helping you have a healthy nervous system starts with me having a healthy nervous system. I'm doing everything I can for myself, and I want to do it for you too. So that's degeneration. Peripheral neuropathy is also a neurodegeneration, but more importantly, we want to have regeneration, right? We want to help the nerves come back to life. So I'm driven to find solutions for myself first and for you. So that's what brings me here. And now it's what's brought you here. We've come together to share this information and solutions. And this is my wife. And so we are up here hiking above some lake, and I think it was up at Courtright, and it was wonderful. So having your feet work well, allows you to do these things. So for me, I had neuropathy in my feet, and I had to find solutions for that. Started to have numbness in a foot, and I thought it was just a weird shoe at first, and then the problem got worse. And so again, this is another thing that's driven me to have solutions for myself, and then ultimately have solutions for you. So who am I? Family chiropractor since 1996. I have to look, and it's been a while, right? So that's almost 30 years. And so my focus has been on chronic health conditions and nervous system health from the very beginning. And I've been board certified in chiropractic neurology since 2007. So what is that? When you think of medical neurology, a medical neurologist is going to help someone with their brain, right? Their nervous system. What are they going to do? Their options are drug, surgery, and advice. So as a chiropractic neurologist, we don't use drugs nor surgery. So certainly we give advice, but what are we going to do if we don't have drugs or surgery to offer? So that's where we rehabilitate function. We help the body be restored, and we use neurological exercises that are specific. And a nerve needs, just like a muscle, needs exercise and needs nutrition. So we'll talk a lot about that tonight. Also certified in functional medicine. That's where we use nutritional testing to check gut health, deficiencies, toxicities, food, and chemical sensitivities. And I've been a lecturer and member of the Interdisciplinary Association of Functional Neurology and Rehabilitation. What is that? Well, if you can say it 3 times fast, you get to join. That's not true, but it seems like it should be. So that's where a bunch of different providers get together and we share how can we help how can we help you get better from a neurological dysfunction or disease. And tonight I'm going to share with you, well, I'll share a lot of things about what's called salutogenesis. And what is that? Well, that's why we get such amazing results in our office, is because we have a different approach. And this word characterizes that a bit. Saluto means health, and genesis, the creation of. It's Latin words, the creation of health. And no amount of focusing on disease is ever going to teach you how to get healthy. So if I want to help you get healthy, I focus on the factors that create health in your body, not those that create disease. Makes sense, right? So I'm going to tell you a story about a patient of mine recently. Her name was Karen. So this is in her own words. My name's Karen Hayes. I was diagnosed with peripheral neuropathy in 2011, but had symptoms long before that. I saw 2 neurologists. I started gabapentin. You probably recognize that. Many of you may have been on that, Neurontin or gabapentin, things like that, Lyrica. I started gabapentin in 2015 and moved to daily Lyrica in 2022. In June 2023, I had decompression surgery, after which my peripheral neuropathy became worse. I started tripping and occasionally falling on our staircase. I saw peripheral neuropathy. Come on in. I saw a peripheral neuropathy neurologist. He was a specialist in peripheral neuropathy, but got no improvement. So she was scared and in pain. I started a thorough evaluation with Dr. Hobbs in October 2023, and I do daily spinal hygiene taught by Dr. Hobbs. It does not take it doesn't take as long, and I'll tell you how long she spent in a minute. Has enabled me to cut back my 3 hours a day of therapies I was doing to lessen my neuropathy pain. She was serious about her neuropathy. 3 hours a day of trying to do things to help her pain go away. And there's not many of us, I'm not sure, including myself, who are as devoted as her to do 3 hours a day of therapy. But if you're in pain, I guess, you get motivated. So yeah, what we have people do is a lot less than 3 hours a day. But even with 3 hours a day, she wasn't getting results. The labs Dr. Hobbs had me do were much more thorough than usual. He found nutritional deficiencies and bacterial overgrowth. Explaining the years of digestion problems, I shared them with my physician, who was impressed. Today is day 20 of no Lyrica and no pain. Now, this is a long time ago, so it's been, I don't know, maybe a year now. Even with 2 storms bringing cold weather, which always set off my pain, for me, this is a miracle. Also, I don't trip or fall anymore. So she got her life back. Now, the things I'm going to share tonight, it's not my opinion. If it is, I'll tell you, but it's things that were published in research reference journals. So these are some of the sources they come from. So what is neuropathy? So neuropathy is damage, disease, or dysfunction of one of the nerves, especially in the peripheral nervous system. What is the peripheral? That's the nerves outside of the spinal cord and brain. So everything else out there. And what is it? Feels like burning, shooting pain, numbness, tingling. But then you can actually get weakness that affects the muscles, atrophy, which is wasting away of the muscles, and caused usually by injury or pressure or inflammation or infection, disease, drugs, toxins, vitamin deficiency. Of course, diabetes is a really common cause, radiation, and we'll talk through some of the causes as well. And it's usually progressive, which means if it starts, it doesn't just stop and get better on its own. That almost never happens. Sometimes it'll stop if you're not taking that medication that caused it. It doesn't get worse. Or if it was radiation that caused it, it may not get worse if you stop that, but you still have the damage and you need to reverse it. So what are the types? There's peripheral, autonomic, focal, and cranial. So peripheral, as we mentioned, is those nerves outside of the spinal cord and brain. Autonomic, those are when the peripheral nervous system actually go to the organs, and those are affected. Focal is a single nerve. Carpal tunnel, things like that. Cranial neuropathy, you have 12 cranial nerves, and cranial neuropathy would be peripheral. So peripheral is everything outside that, and cranial neuropathy, those are actually cranial nerves. They're peripheral, but they're a class of peripheral. All right, so like Bell's palsy would be an example. How many people does this affect? It's 20 million people. Is a low estimate of people who are affected by neuropathy and have some form of neuropathy. But the figure is likely significantly higher because not everybody has neuropathy reports it. So the doctor, even if he knows, may not have reported it and said, oh, this is somebody who has neuropathy. So 20 million people is a low estimate. So two types of peripheral neuropathy. There's mono and poly. Mono is one, so one nerve being damaged, or polyneuropathy, many nerves. So polyneuropathy, we see in polyneuropathy is the most common, where we see diabetes, toxins, poor nutrition, things like that. That causes multiple nerves to be involved. And that's when you have both feet are involved similarly. That's a peripheral neuropathy issue. It's usually not. You could have theoretically a double mononeuropathy, but that's much less common. And so it usually shows up first in the feet and legs, and then the hands. It's because these nerves they're farther away from what we call the cell body, which is where the nerves are nourished. It's where they get their life from, and all their resupply of nutrients and replacement parts. So the farther away you go from the supply store, the more likely you are to go dead, or what's the word I'm looking for? Before dead, just starving of nutrients, right? All right. So peripheral nerves, they're kind of like wires that send signals within your house or internet signal to and from your house. So there's three different ways you can have disrupted nerve signals: loss of signals, extra signals, or distorted signals. So loss of signal would be like, I don't feel anything, I have numbness. Distorted signal would be you're getting a signal, but it's just not normal. And for example, feel like you're walking on cotton, or you can feel it, but it just doesn't feel normal when you touch it. So that would be a distorted or partial loss of the signal. And extra signals would be you feel pain when you shouldn't feel pain. There's nothing stabbing you or cutting you, yet it hurts. So that would be an extra signal. Or the tingling, that's another extra signal. So loss of signals and these extra signals. And this is the nerves go to the skin, but they also go to the heart, go to the muscles, and supplies everything. So neuropathy, it's a nervous system condition. And all these signals, they go up to the brain. And that's the most important part of your central nervous system, of course, controls everything. And the signals come from all parts of your body. And each nerve cell needs to be healthy for the whole system to work the way it's supposed to. So again, kind of like that network of wires in an office or your house. And this is within the nerve, the cellular, all the chemicals have to be working correctly, and they have to reach your brain. They have to have healthy signals, and there can't be any interference. This is a nerve. Two nerves go from your toe to your brain. They're microscopic, and of course there's thousands and thousands of nerves, but each signal goes along one nerve and then to the other. And then it has to go through your spine, so there can't be any dysfunction. And where the nerves come out in your lower back, gluteal area, there can't be toxicity or nerve compression that then would cause foot symptoms or hand symptoms. The complexity of the nervous system is amazing. And all of this is involved in symptoms that come from your hands or your feet. So to feel and function healthy, all parts of your nervous system must be healthy, active, and well nourished. So what are the stages of neuropathy? So they don't always have to go in this order, but generally it starts with numbness and pain. And then stage 2, more regular and persistent symptoms. So same symptoms, just more of them. Stage 3, intense debilitating pain. So it gets worse. And then stage 4, constant numbness. So now you have a loss. This is when it really gets scary. We don't like feeling bad, but even worse is not feeling at all, because then you can start to get cuts you don't know about in infections, and the total loss of feeling. So now you may not feel temperature or pain or heat. So what happens actually to the nerve? Well, symptoms depend on which nerve is damaged. So different nerves. This is a nerve traveling from the feet all the way up to the spinal cord, or the hands to the spinal cord. And so it goes through this nerve, which is coated with what we call myelin. Basically, it's a fat around the cell. So you need to have healthy fat to coat that cell so the nerve sends signals well. And there's a mitochondria in here. So mitochondria will be in the cell body. And in that cell body, the mitochondria makes energy. And the energy is what you need to make the cell run properly. If you don't have the proper cellular energy, which comes from nutrition and your diet, then the cell can't work properly. It starts to degenerate more easily. Or if you have toxins, then that may make it harder for the cell to be healthy, and it gets damaged. So those two things can have an effect. And of course, then you have compression and not being used. So that we said exercise and nutrition. So the exercise, the nerve has to be exercised. Different nerves, depending on where they are, they get exercised different ways. So it needs to be properly nourished and needs to be properly exercised. And nourishment means not too many bad things and not and enough good things. Okay, so different nerves do different things. You have autonomic nerves that run things like the heart, blood pressure, sweat, etc. Sensory nerves, which receive cold and touch and temperature and hot and pain. And then motor nerves, which control strength, muscle contraction. And they have different sizes. So this is the coating, so that fat coating around it. And some of them don't have coating. And you see these are slowest. They don't move, the signals don't go fast if they don't have a coating. And that's okay. That's the way God designed it. Actually, pain travels more slowly than other sensations. And that's part of the reason you can rub your hand. If you hit your thumb, you can rub your hand, and that actually blunts the pain, because this signal will get there faster than the pain signal. So it's pretty cool. But if you have a nerve that's supposed to have a coating and it loses it, then you have trouble. It's kind of like having a wire that no longer has the plastic coating around it. You're more likely to get slow transmission or no transmission, or cross transmission with other wires. So motor nerves, those control movement. All right. And when they're not working properly, you can get cramping. That would be an extra, kind of like the extra sensory sensation. This is the extra motor sensation, muscles contracting when they shouldn't be contracting. Twitching, but also you can get weakness or decreased reflexes. Sensory nerves, of course, those are the ones that perceive things like touch, vibration, and pain. But they also help you balance and have good coordination. And they can send signals extra, like pain or vibration, tingling, or they can have decreased sensation, which would be numbness or decreased feeling. So what does peripheral neuropathy feel like? Well, we mentioned the stages before. This is a little more in depth. First, often is numbness, prickling, or tingling in the toes or fingers. Second comes burning, freezing, throbbing, or shooting pain, and it's often worse at night. So why is it worse at night? So here's a little mystery revealed. So we talked about it before, how those some of those sensory fibers, especially the ones that are coated, they send signals up to the brain, and they're faster, and they go to the spinal cord, and they actually stop a little bit, what we call inhibit pain signals. And so when you're laying down and you're not moving around, you don't have those other sensory fibers sending those signals in. You just have the pain fibers doing that automatic stimulation. And so that's why people often feel worse at night. So next is weakness, numbness. And so that is where your motor nerves start to get involved. They start to be damaged. And a loss of feedback to the brain from the numb area commonly results in not being able to hold something, not knowing where your feet are, and experiencing pain that feels like stabbing or burning. So when we don't have sensation to the brain, or not proper sensation, it is worried. And the way it tells us it's worried is pain. So it starts to generate its own sensation. And then we're like, what's supposed to happen is we step on a sticker and we're like, ouch, that hurts. Get your foot off the sticker, and then everything's good. Pull it out and you're all good to go. But if you have pain because of loss of sensation, you're like, I can't step off my sticker. There's nothing, I don't know what to do. And what you need is to regenerate the nerve. And that's not as easy as pulling out a sticker. Okay, and finally, the numbness makes you unaware of cuts and nicks that lead to ulcers and amputation of the toes. So these are different stages. Still, one of the most common causes of amputation is diabetes, which is the most common cause of peripheral neuropathy. All right, so how do we measure that sensation? So we measure it through monofilament testing. So what is that? Well, it's kind of like this. It's like a little fishing line that we touch on the bottom of your foot, on your hand. And when it bends at a certain force. And that's how we, and then we can quantify that. Can you feel that? Can you feel this 10 grams of force? Can you feel this 0.4 grams of force? Can you feel this 0.07 grams of force? And then we can determine at the point where you're like, no, I don't feel that anymore. Okay, then we can write that down, and then we know exactly how good your sensor, your touch sensation is. So most doctors just use the 10 gram, which is severe loss. Once you can't feel a 10 gram, that's what we put when we give you a picture of what your sensation loss is. That's black, because that's scary. At the point you can't perceive 10 grams, then you're statistically much more likely to not feel a cut or an infection. And so I tell people that have black spots, not literal black spots, that would be really bad, but black spots on our graph, then you need to look at your foot every single day, or have somebody else look at it, because if you get any kind of a cut, you need to make sure you're taking care of it, because you probably won't know. We also check for warm and cool perception testing. So it's temperature threshold, vibration perception testing, objective vibration threshold. So we'll do hit a tuning fork, put it on the top of your toe, or finger underneath, and you tell me when you stop feeling it, and then I'll write down when I stop feeling it. And of course, you should feel it longer than I feel it through your toe, right? So if it's the same, then we're good. So, but we'll write down that number, and so we know exactly how long it took. And then motor strength testing, objective grip strength for your hands, and we'll do toe strength for the toes, and we can quantify how good those are. Now, everybody has different strength. There's not a, this is how strong you should be, otherwise you're damaged. But we can compare it to one side to the other. Check over time until it's improving. All right, we talked about autonomic nerves. They're super important. They control organs and regulate activities that people don't control as automatic. So all these organs, parts of your eye, your lungs, your heart, your liver, stomach, pancreas, intestines, all these things are controlled. And they have wide, long-lasting impact, and it's often overlooked and underdiagnosed. So there's different parts. There's the parasympathetic. I'll give you guys you got the big screen. Parasympathetic, which is rest, digest, repair, and development. And the fight, flight, and freeze is sympathetic. So if you just remember that, you'll be doing pretty good. But this is growth and potential. And this is survival. So which one is most important? That's a trick question. They're both most important, right? You can't really have one without the other. When you need to survive, you need to have this, or you die. You don't have the chance for growth and potential. But if you're always in survival, then you don't have a chance for growth, because they're like a teeter-totter. There's a balance with these. So you need to have be in this stage most often, but you need to have this healthy so it can work when it needs to. So parasympathetic, it works, constricts pupils, increases salivation, slows your heart rate, constricts your bronchi and your lungs, increases digestive functions, contracts bladder. Whereas the sympathetic stimulates tear glands, dilates your pupils, so you can get the whole scene in, increases salivation and sweating, increases heart rate, dilates your bronchi so you can breathe more, decreases digestive function, because when you're in survival mode, you don't need to be taking time to digest the food you just ate. It's like, I'll deal with that later. So, but if you're always in this state, you can see how it inhibits bladder contraction. You don't digest well, you may hold on to bladder, more likely, or urine, more likely to have infections, more likely to have increased heart rate, heart problems. So this is just a little graphic showing the autonomic nervous system in action with your heart, and this would be symbolic of your diaphragm as you're breathing. So that vagus nerve and other autonomic nerves, they control your automatic or autonomic nervous system. Now, if it's not working well, these are some of the symptoms you may find: from low parasympathetic function, constipation, chronic fatigue, adrenal fatigue, brain fog, mood issues, autoimmune disease, and high sympathetic, poor sleep, anxiety, irritability, ADHD problems, other neurodevelopmental disorders. So we test for autonomic nervous system function. One way we do that is the thermography testing. So this is some research done. Autonomic dysfunction can be evaluated by measuring skin temperature differences. Skin temperature differences are associated with vertebral subluxation. So we measure left versus right. Blood vessels control temperature. Blood vessels are an organ controlled by nerves. Those same nerves branch off to regulate organ function deep inside. And so the research showed that this is actually a viable way of determining. You don't diagnose organ dysfunction that way, but you can diagnose nerve health that go to organs. So these values can be used as a standard in the assessment of sympathetic nerve function and degree of asymmetry or imbalance in your autonomic nervous system function. So this is an example of one test on a young man we did. So he had these conditions where his body would freeze up. He was 7 years old, and his body would just freeze up, sometimes for minutes, sometimes all day. He could move his legs and stuff, but he couldn't really bend his spine. So he had a lot of these high intensity imbalance in these numbers. This is on May 2023, and he had these big bars up here. And then August 2023, those are gone. He has still some here, and he's got some down here, but much improved. So, and his symptoms were much improved as well. So here's another story. This is Ellen. Ellen was dependent upon insulin, but she still had a love for life. So even medicated, her blood sugar was still not well under control. She came in with another elderly friend in similar circumstances, but neither one of them were, Ellen was over fat, but her friend was not. So one of them had obesity, one of them didn't. They'd been to another doctor who was in Fresno because they had neuropathy, both of them. And they were asked to be prepared to pay $10,000 each, which apparently was a 50% off special. It was going to be $20,000, but he said, since there's two of you coming, then I'll do half off, just $10,000 each. I was like, that's a lot of money. So what we did first with her was the eating program. I said, well, first let's get your sugar under control, because that's killing your nerves. So the changes that occurred in their bodies from this weight loss and blood sugar control were impressive and dramatically slowed the progression of their neuropathy, but it didn't reverse it. It does tend to stop it if that's the cause of it, but it won't turn it around. So step 2, we did peripheral neuropathy specific treatment and continued her home therapy and office therapy for 15 weeks. After reevaluations, we found dramatically reduced numbness, and she can now sleep without pain. And that sleep time is often when it's worse, because you don't have those nerves that are inhibiting pain anymore. So she was now sleeping well, and that was really the most important thing to her. Can I get rid of this enough so I can sleep without feeling torture? So we did. So now I talked about causes. This is a bigger list of the causes of neuropathy. So we've got trauma, repetitive stress or biomechanical pressure. This is very common. Now, this is not common for peripheral neuropathy, but it is common for some forms of neuropathy. Diabetes is very common. Also, nutritional or vitamin imbalances are very common. Alcoholism, exposure to toxins, vascular issues, autoimmune disease. Most common cause of neuropathy is diabetes. One of the next most common is gluten neuropathy. If gluten causes an autoimmune reaction, which it often does in people that are reactive to it, not everybody is, but it can cause damage to those peripheral nerves. Chemotherapy drugs for cancer often cause neuropathy. And the good thing about chemotherapy neuropathy is when you stop it, and then we don't have to work against something that's continuing to cause damage in your body. It just caused it in the past, and now we just have to heal that damage. Also, radiation therapy, similar. Long COVID, a lot of people complain of neuropathy symptoms after having COVID. Kidney and liver disorders, that's a tough one. I've got a couple patients right now who have waiting for a kidney transplant, and it tends to cause neuropathy. And until they get a new healthy liver or kidney, then it continues to cause neuropathy. So we help it, and we can help them get better usually, but they don't get as well as other people because they have a condition that continues to cause it. So we're just trying to keep them getting worse. And then prescription medications, really, thought prescriptions were supposed to help things. So yeah, medications can cause neuropathy. Here's a prescription for long death, but you can feel better as you get worse. Heart or blood pressure drugs. They may save your life, but they also may cause neuropathy. Drugs used to treat high cholesterol, fight cancer, fight infections, treat autoimmune disease, treat seizures, anti-alcohol drugs, and drugs to fight HIV or AIDS. So it's not that all these cause it all the time, but these all have a tendency to cause neuropathy. So it's no wonder so many people have it. So what's a doctor to do? Because he's got patients demanding and paying for solutions that are quick, easy, and cheap. It's like, hey, doctor, I need a solution right now for my problems. I'm not feeling good. Make me feel good. And pharmaceutical reps and research publications, even the FDA approval and medical schools costs are largely funded by drug companies themselves. So this is why RFK Jr. is working to not have pharmaceuticals have as much control over the FDA, because their funding largely comes from drug companies. Now, it seems like kind of a good idea, actually. It's like, well, these are the people who are making the FDA do all the work. They should be paying for some of it, right? That makes sense. But they can actually pay for, and they do, and then they can pay for expedited approval. That sounds a lot like a bribe. But it's not, in the right hands, it's not a bribe. It's just, hey, I'm paying you for extra work, and I don't want the taxpayer to have to pay for it. So, it could work really well, but it also could be really bad. When you've got the people seeking the approval paying the paycheck, people approving it, not so indirectly. Also, insurances and clinics demand cost cutting by seeing more people for shorter times. It's like, I'd love to help you, but I got to get on the next patient. So, I could coach you on lifestyle changing, but I think we just need to go to the next person. So here's a prescription. This should make you feel better, make you happy. All right. And often, patients often, go back to here, patients demand a solution that's quick, easy, and insurance pays for. So it's like, okay, doctor, no, I don't want to change my life. I don't want to exercise more. I'm already exercising enough. I'm too busy. I've got 3 kids. Why are you asking me to do all these things? Don't you have a pill for this? It's like, well, I do, but it's not going to heal you. It's just going to make you feel better. But it's on the list of things approved for it. So here it is, and everybody's happy, but nobody's more well for it. So, did you know all this information? So I'm going to share more. This is not the end of it, but it's like, why, how long have you had these symptoms? You think about how long has this been going on? How many doctors have you seen? After I see people who've seen a lot of doctors for these things, and you think of Karen Hayes, who had seen a podiatrist who was a neuropathy specialist. That's like the specialist of specialists, right? It's like foot neuropathy. It's like, yes, that's what I need. And he just gave her medication. Why were you not told? We've explored some of those ideas and maybe why. I generally think the local doctor really has your best interest in mind. I don't think the system necessarily does, but I think the doctors generally do. They're just pressed from all sides, and almost nobody really wants a solution. They just want a quick fix. So that's what they're educated for. That's what they're encouraged to do. And decades of consumers demanding quick fixes, and human nature, and desire for not wasting time or effort. So they make us think, I want all my health care to look like this, quick, easy, and cheap. And that's not wrong to want that. But if it means that we undermine our own success and our own recovery, then that's not good. And drug companies say, well, we can meet that need if you'll pay us handsomely for it. So it's a cycle. It's like, I want quick, easy, cheap. And some pharmaceuticals are like, well, let's research something that's quick, easy, and cheap. That really makes you feel better, even if it doesn't make you well. So, all right. So long COVID, 61% of COVID-19 patients were seeking neuropathic pain treatments at follow-up. Just a little unfun fact. Diabetes, 30 million people in the U.S. have diabetes. At least 50% of diabetic individuals will develop diabetic neuropathy. Exercise and dietary changes are shown to prevent and improve neuropathic pain. So, yes, for sure, diet and exercise, you need regardless of what they have diabetes or not. But it doesn't, it can prevent it, and it can reduce some of the pain in some people, but often it doesn't. It certainly won't reverse your condition, but it can stop it, and we need to do that. All right, so this, okay. So nutritional power, this is like supplying the power to the body, to the nerves, through nutrition. And this has to do with autoimmunity in this case, so it's preventing that interruption of power. So this is a wheat and gluten test. So in this case, this patient was highly reactive to wheat immunoglobulin G. Okay, so they had a wheat reaction, which is not specifically gluten, but gluten is common in wheat. We did other tests as well, but that was the one that really showed up in them. So they should not eat wheat. Now, was it causing a problem in their body? Because just because someone has a reaction doesn't mean it's causing autoimmunity. So in this case, I'm going to have you guys zoom in. So you in the room here, when I'm doing this online, and people can sometimes see the whole screen, or they see me, the whole thing, the room and the screen. So I zoom in sometimes so they can see better. So in this case, transglutaminase 3. So what is that? So that goes to the skin. TTG6 goes to nerve tissue, brain or peripheral neuropathy. So they didn't have neuropathy autoimmunity. That was good. But they did have skin autoimmunity, likely related to their gluten or the wheat sensitivity. So that's one of the tests we can do. Here's another test looking for deficiencies. This is just a high view summary of the need. So these nutrients they were doing pretty well in. These they were a little deficient in. These they were very deficient in. So supplying the nutrients for this patient is going to make a huge difference in their nerve health and other functions as well. Biomechanical alignment is also important. Altered curvatures and position of the spine will put strain and pressure on the spinal cord or peripheral nerves as they exit the spine. So loss of curvature, that can be a problem. Postural stress, that's the position that you choose. You think about spinal hygiene. And malalignment or misalignment, that can be in local areas. So local areas in the spine, that's what we feel when we're checking for subluxations. When people get in for adjustments, we're feeling that misalignment locally. So any of those can be causes of biomechanical problems, which then contribute to neuropathy. So regardless of the type or cause of neuropathy, nervous system interference or dysfunction will always limit healing and optimal function. So let's say somebody comes in and they have diabetes, and diabetes Well, certainly can cause neuropathy. So do they need correction to their spine? Yes, because we want to give them every chance they have, because they have interference in the spine and they have diabetes. Well, now they've got two problems contributing to this. So we want to eliminate as many problems as we can to allow the nerves to flow and heal normally. So here's some research on spinal biomechanics. Patients with mild to moderate carpal tunnel syndrome, so that's in the wrist and hand, right, causing nerves. That's a mononeuropathy, not the peripheral, but it gives us an idea of this biomechanical issue. Exhibited a greater forward head posture and less cervical range of motion as compared to healthy controls. So people with carpal tunnel problems, the wrist and hand, had worse posture in their neck. Okay, where do the nerves to the hand come from? They come from the neck. So if you have interruption here, it's going to be more probable for you to also have interruption here. But if you have a hose and you step on it in one place, you're probably going to slow the water down a little bit, but the water's still going to come out, and you may not really notice the tree's not going to die or the bush is not going to die. But if you put a cinder block one place and you put it another place too, now maybe that water stops entirely, and then the plant dies. Same thing with the nerve flow from your, in this case, from your neck down to your hand, but also could be from your lower back to your feet. The more places you crush it, the more ways you interfere with it, the more likely you are to have it damaged, not working the way it needs to. And then when they did a forward head posture is strongly related to motor nerve conduction impairment. Okay, so carpal tunnel syndrome, usually that's a sensory issue, but also, loss of sensation, but it also can be motor, which is weakness, right? So that's this one. Forward head posture strongly related to motor nerve conduction impairment. So when they tested the nerves to the muscles, they were interfered with people who had head forward posture. And we found that forward head posture makes patients more prone to peripheral nerve entrapments and leads to upper extremity disabilities, things like carpal tunnel syndrome. Okay? And more importantly, corrective programs to improve forward head posture decreased pain and increased the function of the nerves from the neck to the hands. All right, so we know there's a correlation, but now we know there's a correction. That's even better. So we look at biomechanics of the spine. In this case, especially of the neck, these are the most important, but we look at them throughout the spine. Vertebral subluxation is a misalignment of the spinal column which negatively affects neurological function or nerve function. Right? So when the joints aren't working right, the nerves don't work right. So let's tell a story. This is about a patient. She was 80 years old, a female. She had constant diarrhea and constipation. She couldn't do her housework or care for her husband, was even worse off than she was. So this is, we're going to talk about the impact of biomechanics or body movement, joint movement on autonomic function. What's autonomic? That is things like digestion, intestinal function. And if it's not functioning, that would be diarrhea or constipation. Okay, so she went to her doctor. Her doctor gave her a prescription. Said, okay, well, this should make you feel better and function better. She said, no, it didn't. He said, okay, well, let's take an x-ray. So the doctor really is trying to find a solution. And nothing on the x-ray. Now he's taking an MRI. And so this doctor really is taking her seriously. Doctors might say, hey, you're 80. What do you expect? Right? But he really took her seriously. He's like, well, we're going to find a solution for you because I know you're serious. And there's nothing on the MRI that was a problem. So he gave her Vicodin. It's like, well, you're suffering, so hopefully this just make you feel better. So they're looking for infection, disease, and trauma. And they've got infection, disease, and trauma tools to help people. And if you don't have an infection, disease, or trauma, they may still give you one of those tools, drugs or surgery, to try to help you feel better. But it's not going to make you well. It's just going to make you feel better. So she didn't, because now she's feeling hopeless. So she came into us, and we took an x-ray, and she had a 46 millimeter head forward posture. Should be 0. And on follow-up, she improved a lot. This was how much she improved. A lot less head forward posture. But more importantly to me and her bowel movements were much improved. That's an autonomic nervous system function. She was now able to cook and clean and not dependent on medication. That was awesome. She didn't want to run a marathon. She just wanted to be able to cook and clean for her husband and not have to worry about going to the toilet 10 times a day and not have to be on all these drugs. So think about you now and the consequences of neuropathy. Think about the last 5 to 10 years. Places you have gone or haven't gone, things you haven't done. Think about strength, energy, focus, sleep, prescription side effects. Over the last 5 to 10 years, how has that been going? Are there things that you're missing out on or things that are getting worse? And then think about the next 5 to 10 years. If you don't do anything or don't do enough of the right things, just take Lyrica or Gabafent. What are those for? Those are for making you feel better. It's kind of like putting, if you go to the car, the repairman for your car, and he puts a piece of black tape over your check engine light and pours ice on your overheating engine. You're like, well, I guess it's better. I can't see there's a problem, and it's not exploding right now, so I guess we're okay. It's like, well, that would be malpractice by a repairman. So, but we kind of expect this from our doctor. Just make me feel better even if I keep getting worse. Don't ask me to change my lifestyle. Well, you guys are listening. You're here because that's not the way you want to work. It's like, no, I really want to get to the cause. I want to fix this. I don't want to just put my head in the sand while it gets worse. 25% of people with diabetes will develop a foot ulcer, and 90% of hospital admissions for diabetic foot ulcers are related to peripheral neuropathy and infection. So that's kind of gross. I don't want to look at that. So let's tell us a joke now. Maybe it's a joke. Maybe it's real. Okay. So I have a friend who was on an airplane, and he was sitting by this guy, and this guy really should have had 2 seats. He was a big boy. And he's sitting there, and there's another person on the other side, so my friend's in the middle, and sharing his third of his seat. and the guy next to him is talking. He's got a sugary granola bar, and he's got a soda, chewing on this, drinking the soda. And he starts talking about health and finds out my friend's a doctor and says, yeah, I've got these problems and my family has these problems. And he's like, yeah, I think it just runs in my family. And my friend looks over and he goes, I think the problem is nobody runs in your family. So the way we think, I don't know that he really said that, but so the way you think organizes your behaviors. So if he's thinking like, it just runs in my family, there's nothing I can do about it, so I'm just going to be happy. That affects your behaviors, and your behaviors predict your outcomes. So yes, because he thinks that, that's how he's going to end up being, because he acts that way. So let's not be that way. Let's change our behaviors. First, by changing our thoughts. And I've given you a lot to think about tonight, and I'll have more, but there's already a lot. So what are your options if you have less neuropathy? So you can think about things that you can do. What if you had all your health back? What would you do differently? So I had a patient came in just a couple days ago. He had, when we started with him, he had a bulging disc, numbness, and I think he had some weakness in his leg as well. He's about 35 years old, younger man, and, young family. And he was pretty messed up. And he was having, had to walk with a limp and had pain and had numbness. And now I saw him and he doesn't have any of that. So he's not perfect, but he's feeling pretty good. And I said, okay, what are your goals going forward for this next year? He's like, well, I want to get more treatment and do more exercise. I said, okay, well, I'll give you more treatment, but that's not really a goal. I want a bigger goal. He's like, well, I used to golf. I'm like, all right, now we're talking. And yes, golfing would be terrible for somebody with a herniated disc. So it was good. He needs to heal. And then we need to gradually rehabilitate him. And I'm giving some exercises to do, some twisting exercises. He's got kettlebells at home, and so we showed him how to do that safely. So he can gradually rehabilitate and ultimately be able to go back golfing. So that's a goal. What do you want to do with your health? What would you do if you had your health back? What would you do that you can't do or don't do the way you want to do now? Oh, that's a lot of do's in there. What would you do if you had your body back? So it's like if I could feel my foot normally. I'll tell this. I've got another patient. We'll tell his story later. He's kind of fun. This lady, she said, I got my husband back. So how would you live life? How would you live the life you want to live? All right, so here's a middle-aged gentleman, working professional, and he loves golf. Not the same one I was talking about. He asked if there was anything I could do to help with neuropathy because he was getting worse and might start interfering with his golf. And that was really bad. You know when it's bad when you start not being able to golf the way you want to, right? So I'm not a golfer, but serious. Okay. But it really was serious. That's what he enjoyed in life. He couldn't do it very well. It's starting to interfere with it. And it was already making walking and sleep uncomfortable. So the problem is I'm short on time. So he was a busy businessman. So differential diagnosis, that's what DDX stands for. He wasn't diabetic. He hadn't had radiation. He wasn't on medication. And he didn't have any known autoimmune condition. There was no cause that we could figure out that seemed to make sense. Some areas were already halfway to the dangerous high-risk level of sensory loss. So when it gets all the way to zero, the risk of infection and amputation raises dramatically. He understood the seriousness and said he was willing to make time if he could really see improvements. So we moved ahead with the treatment to promote healing in the nerves. After only a month, our testing showed his sensation had already improved. So that was pretty cool. So even though we had no idea what the cause was, and maybe the cause was gone, but his problem was still present. So he had improvement. He can now feel almost normally in areas where he could barely feel before. And that was amazing, but at this point it's no longer surprising. If you asked me a few years ago, I've got numbness in my feet. Can you help that go away? Can I get my numbness, my feeling back? I would have said, no, but we can probably stop it from getting worse. Well, now I know almost always, yes, we can almost always get that back. There's sometimes we can't so far, like patients who have, they're on dialysis, they're waiting for a kidney transplant. We have a lot of difficulty making that sensation come back, but we actually are able to give them more comfort. They can sleep better and things like that. So we were able to promote some healing, just can't regenerate it while they're still damaging it. All right, so what does the discovery process or evaluation look like? So step one, neuropathy specific history and neuropathy severity and spinal screening. Your symptoms and history, clinical sensory-motor scoring system for peripheral neuropathy. Wow, that sounds fancy. That's that monofilament testing and the temperature and the vibration, all those things. Spinal motion palpation and nervous system scan to detect spinal nerve interference. That's what we do with our patients who have come in for chiropractic care. So for you, we've already done spinal work. We were working the spine really well, and so that's all dialed in. Structural and neurological testing. So we do more history on trauma, treatment, recovery. We look at things structural, chemical, and mental. Fill out a metabolic assessment form that goes through different organ systems that may be causing interference. We do neurological testing for the autonomic nervous system, checking heart rate variability. We also will call that adaptability reserve. How much reserve do you have to adapt to stress? And computerized balance evaluation. That way we can see how much that loss of sensation is interfering with your balance, and then we can check that over time as it gets better. Doing other things, postural, gait, digital foot analysis, and x-ray as needed. And then functional lab testing. So we showed one example of that, looking for deficiencies, leaky gut syndrome, toxicity, autoimmunity, gluten sensitivity, things like that. So really thorough assessment to really find out how we can get your body all well. So complete evaluation cost, usually it's $375 for all that, which is actually a really good deal. For this seminar price, if somebody asks for this while you're on, within a week of this presentation, what's today, today is March 27, 2025. So within a week, then I'll give you this price. It does not include lab testing though, so it includes all this other part up here. And for a patient who's already had much of that, then we do it even less. All right, chiropractic spinal adjustments. What's the treatment process? So this is for somebody who's got moderate neuropathy. It depends on the severity, what we do, obviously, but this gives you a general estimate. of what we do and what it would cost. So to remove the spinal nerve interference and restore nerve flow and communication. So 20 visits over 6 months. So again, if you're already under chiropractic care, then that would already be taken care of. Part 2, photobiomodulation. Ooh, that's a fancy word. Photo, that's light. Bio is living things, and modulation is changing. So changing life through light. So with laser, in office, we use the Erconia 635 nanometer laser to nerve to promote healing. And at home, you'd use a high energy 10 watt red and infrared light therapy. And that would be about 4 or 5 minutes a day at most that you'd have to use that. And this would be 20 sessions over 2 weeks, 10 weeks. And then part 3, nutritional. So depending on what we find in our questionnaires and our history, testing, diet changes, supplementation recommendations. The personalized deficiencies, leaky gut syndrome, toxicity, and more, as we find out what's the problem, what if anything needs to change. And then progress reevaluations, nervous system as well as the spine, as well as neuropathy. All right, so what would all that cost for somebody who has moderate severity? We rate that on our assessments. This would be about a 2.5. So over 6 months, including all that treatment, it would be 55.25. For 12 months, which basically we're helping to maintain over the next 6 months, it would be 59.60, which is not too much more. That includes a discount, actually. And that includes lab interpretations. For lab testing, there is another cost. Depending on what lab we decide you need to do, there'd be a cost for that. And any supplements you might need to take, there'd be extra for that. So if we figure all that, might be $8,000, all this included. So it's a general estimate, and that would be for a full year. And that would include the chiropractic, the light therapy, nutritional testing and treatment, and supplementation and reevaluations for a full year. Okay, so now Mr. Castillo, he's 81 years old. He had foot pain and numbness for 12 years. So this was not something new for him. And I would have told somebody, if you've had it for 12 years, yeah, I think you're stuck with it, right? He's not going to make those nerves come back. But now I know better. And it was progressively worsening 1 week after a colonoscopy a few months ago. So he had neuropathy, then he got a colonoscopy. This is the second patient I've had who got a colonoscopy, and the neuropathy got worse. I don't know why that is. I wouldn't say that's a common thing, but maybe it is. So he was no longer motivated to get up and move. He gave up walking almost entirely, and that's what he and his wife loved to do. So he was taking gabapentin, but still he was in a 10 out of 10 burning and electric-like pain at all times. So this is miserable. And he's like, I don't even have a reason to live anymore. He didn't say that, but that's kind of what it seemed like. And this is an x-ray of his neck. He had fusions in his neck. He had this massive head forward posture. We can't fix most of that. It's all fused together. But less than 3 months into treatment, we did another reevaluation, and we've seen a 50% improvement in nerve function healing on our testing. I was amazed. But more importantly, his wife says, I got my husband back. He's joining me again on walks and is willing to go to social events again. So that was super cool. So that's what matters to them. This is what matters to research. And I like data, right? But I like this too, because if we don't get this, then none of this matters, right? Oh, that's the end. So, and nobody online, I can't take your questions now, but if you have any, let me put my face back. If you have any questions, you can give us a call, or you can email us. The phone number is in the description down below the video, and it's 559-635-8266, or you can come visit us. And that offer I mentioned is good for the next week. This one. Okay. Do you have any questions or comments?
No, not a whole lot. Mine's fairly mild.
Mm-hmm.
And I have, like I told you the last last week or whatever, I was taking some over-the-counter stuff, and I thought it made my blood pressure go up, so I quit.
Right.
And it didn't help anyway. But actually, what I am doing that seems to help right now, you know, the neck massager,
Mm-hmm.
I put my feet on it,
All right.
and they feel better.
Yeah. And now you know why. Do you know why? From what we covered?
Well, because of sensations of, you know, you get more, it's because of, you're stimulating.
Yeah, you're stimulating those nerves that actually block pain.
Right.
Yeah. Very good. I'm going to go ahead and shut down the presentation here.